So in the previous video, we showed you how to use different types of slings. For this demonstration with the Hoyer lift, we're going to use this sling. So we have our client right here in the chair. I'm going to move her from chair to the wheelchair using the Hoyer lift. So with this sling, you're going to want to make sure this side is flush against their body. So you're going to come around the chair and you're going to say, I'm going to have you lean forward a little bit. This U goes to the bottom of their spine right here. You want to put the legs on either side of your client. Tug down right there. And then make sure the legs are where you can reach them and move these straps out of the way so they're not behind your client. Okay, I'm going to have you lean back. And when you're lifting the legs to put these straps underneath, make sure you're not just grabbing them like that because fingertips do hurt frail skin. So you want to scoop the leg and then take this and put it underneath. So you make sure that it's underneath, and you can pull it when you scoop the leg too to really make sure that it is set. Make sure that the Hoyer sling is flush against the client and it's not pinched or twisted in any part, because once you start pumping it up, it could pinch. Okay, I'm going to do the same for the other side. And make sure to tell your client what you're doing as you're doing it. Now, you can cross them. We do suggest crossing them so they don't fall out if they're wiggling around. So I'm going to cross the legs right here. I'm going to put those at the side, and then I'm going to go grab my Hoyer lift. And as I'm approaching the patient, I'm going to open these legs to a wide stance. Approach. Lock your wheels, and you can always adjust if you need to get closer. There is a valve release right here. So I'm going to open it and move the lift down so I have an easier time putting the straps on the hooks. Now I can already tell I'm not close enough. So I'm going to unlock the wheels. And I'm going to move a little bit closer. And when you're moving closer, you want to make sure that the front of the Hoyer does not hit your patient. I've locked the release right here, and I am going to put the straps in the hooks. It's easier to do one section at a time. So for this, I am doing the top first. Make sure you're doing the same straps, and then I'm doing the bottom. Okay. You feel okay?
Yep.
Okay. And then there is a pump bar right here. You're going to start pumping up. And as you're pumping up, again, make sure that your client does not lean forward into the bar right here. And just pay attention as you're pumping that they aren't uncomfortable. And you can ask them, how does it feel?
Very good.
Because
Loving it.
now as there is some pressure on the sling, I'm going to pump her up a few more times. And I'm going to show you how fast that they can go down if the valve were to just be opened. Like if you walk away for a minute, which you shouldn't do, and they maybe have a cognitive impairment. That's the word I'm looking for. If they have a cognitive impairment and they just reach forward and start playing with this is how quickly they can go down. Right? Yeah. And you can see she's slouching now. So if I had walked away, she could slide right out of that chair. So now we're going to pump her back up. There we go. Now I'm going to unlock the wheels. I'm going to use the handlebars and I'm going to bring her forward. And I'm going to move her to the wheelchair. Lock the wheels. Make sure she is in a good position and slowly release. And as you are releasing, you can come back to behind her and reach your hand down to where the handle is and adjust her. So that way she is sitting in a better position. But again, make sure you don't hit your client with the bar. Okay, then I'm going to lock it. I'm going to remove the straps. Then I'm going to pull the Hoyer away. I'm going to close the legs. And then I'm going to take the sling out from underneath the client. So uncross, scoop the leg. Untuck from behind. Can you lean forward for me? Thank you. And pull out. Simple as that.